Hello, I'm Jennings. I practice CranioSacral Therapy, and I would like to take this opportunity to explain to you a little bit about what CranioSacral Therapy is and how it might be useful. CranioSacral Therapy is a body therapy. It's a modality that's designed to treat restrictions to the craniosacral system. The craniosacral system is a body system in the same way that your digestive system or your cardiovascular system are body systems. And the craniosacral system consists first of all of the bones of the skull. And here you can see there's a life-size model of a human skull. The bones are in different colors for identification purposes, but you can see, if you look here, that where the bones meet, they're like fingers interlocking, or teeth or gears or any other such description. And they're like that because these bones have to be free to move. And the reason they have to be free to move is that the cerebrospinal fluid, which is the environment that the brain and the spinal cord live in, needs to come in, bringing in fresh nutrients, and it needs to go away again, taking away the waste products from the brain and from the spinal cord. And so you have this flow in and this flow out, and that happens, the average is between about 8 and 12 times a minute. So these bones have to move, and the membranes that surround the brain and the spinal cord also have to move with them. Now, you can get a better idea of that if I show you this model here. If you look at this yellow thing here that's running down in the spine, what would be the spinal canal, and it has these sleeves in it. You see it better if I turn this around. It has these sleeves in it that bring the nerves out through the bony parts of the spine, and then they go off to the target organs and tissues here. So this membrane comes, go around the brain, it comes all the way down here, and then it comes out into the pelvic cavity here, again with nerves coming out there. And if I turn this around, you can see that this big bone here, which is another part of the system, is the sacrum. And this bone here is the coccyx or tailbone. Now, as I mentioned, the bones have to move. The membranes have to move with them, because if they didn't move with them, everything would be a bit stiff and it wouldn't move really very well. And because the membranes attach onto this sacrum here, that also moves backwards and forwards like that in a sort of rocking motion. And so when that's all working freely, you're getting a nice flow of cerebrospinal fluid in and a nice flow away again. Nutrients coming in, waste products going away. So where does craniosacral therapy come in? It comes in when we get restrictions to this system. And for instance, you could get, going through a low doorway or something like that, bang your head, or you could fall over and bang your head, and that could jam some of these joints. And so craniosacral therapy would very gently, with very, very refined techniques, manage to disengage those bones that were jammed again. And the other thing that could happen is that here, the muscles of the neck coming up attach on to the cranial bones here. And if you strain your neck, or you get a jolt, or you sleep badly or whatever, in a draft, or anything that can affect the muscles of the neck, they would become tight and they could pull on these bones, which again would stop them moving. And when you get any sort of restriction like that, I mean, for instance, if the muscles of the neck were tight and they pulled on these bones here, you wouldn't be getting the nice flow of cerebrospinal fluid bringing in the nutrients and the waste going away, so the system would be a bit sluggish. The other thing is it'll pull on the membranes attaching on the inside of the skull, and that can then cause pain or discomfort, and it can affect the cranial nerves going to the eyes or going to any of the muscles in this area here. And so you can end up with getting things like headaches or migraines or blurred vision or a whole host, depending on where the pull comes and which nerves are affected. Also here, things that can occur is, for instance, you've got lots of muscles attaching onto here to keep us upright and so that we can bend and twist and do all the work that the body needs to do. But again, if these muscles get tight or strained, if you lift something too heavy, or you fall over and you pull a muscle, these muscles get tight, they can start pulling on these sleeves. And they can pull here and send a drag that goes up and starts affecting areas up here. Or you can have a pull up here in the shoulder area, and that can go down and reflect as lower back pain, or perhaps even digestive dysfunction down here. So there's lots of things that can happen as a result of falls, bangs and bumps and that sort of thing. And craniosacral therapy is marvellous for locating these areas of restriction and freeing them out so that the whole system can operate smoothly and easily again, bringing in the nutrients, taking away the waste products without any drags or tensions. And we have what's called homeostasis. The body is in that nice state where everything is working as it should do. So craniosacral therapy is extremely important for dealing with any sort of problem in this sort of area. I mentioned digestive problems. Ladies can have menstrual problems, for instance, through tensions that are down in this area here. There can be fertility problems. And there's a whole host of other things that are quite often poorly understood because the mechanism by which they occur is not understood, because it pulls on these membranes here or the cranial bones. So craniosacral therapy deals with all of that type of problem and makes sure that this is all free and functioning properly. This bone is moving properly, the membrane is moving properly, the cranial bones are moving properly. You're getting the full flow of cerebrospinal fluid in and the waste away. So that's basically what craniosacral therapy does.